We are Team Cryptix, and this is the video presentation for the idea submission round of problem statement 1. Currently, there is dysfunction in healthcare as there is 30% of annual wastage in healthcare expenditure. There is also an unsustainable rise in healthcare costs. And as you can currently see, the total cost of healthcare outweighs the outcomes of the patients heavily. So, to solve this, we have four pillars in our project. These include improvement in patient outcomes, patient experience in receiving care, clinician experience in providing care, and lastly, but most importantly, effectiveness and efficiency of the care. To further understand the issues which are currently there in the healthcare system, we'll be explaining it to you via an example. So meet Mr. and Mrs. John, a retired couple whose kids live abroad. Mr. John has been experiencing blurred vision and unintentional weight loss, and they do not know what to do. They've spent a lot of time and energy visiting hospitals, and as well, they've spent a lot of money. But there have been so far no positive outcomes. Presenting MEDHEAD. Our new product, MEDHEAD, aims to address the inadequacies in the current healthcare system by providing access to basic health and medical information for the patient. We'll be further showing you the application and the way it will be helping to solve Mr. John's current problem and conditions. When you launch our website, you'll be first greeted with our sign up page. If you're a new user, do enter the credentials and sign up. But if you're an existing user, click on the login button. And once you click on the login button, you'll be reaching the login page. Here you can enter your credentials and log into the website. Once you click on login, you'll be greeted with a main or the landing page. And once you reach the landing page, you'll be seeing the entire details of our websites as well as all the unique features which are present in our website. And as you can see in the bottom right corner, there's even a chatbot. This chatbot helps in clearing all your queries regarding the health issues or anything regarding the website as well. It also has a key and a unique feature which is changing your gym or diet plan. More about this later. Once you click on the dashboard button, you will be taken towards the dashboard page where you can see what Mr. John is currently facing, that is his blood pressure and hemoglobin. Mr. John now can also even see his calendar where he can organize anything, add events, or add like check his past history of his reports or anything, etc. Mr. John can now see details as well. That is nothing but his blood, his height, his weight, etc. And he'll also be greeted with a blog which can be done using ad targeting or our own expert level recommended blogs. Then you can see there's a friends area. These friends area shows all the current friends. And the most important part of friends is he can also view his friends and his charts as well and draw comparison between both of them, showing the urgent need and comparison between his health and friend's health as well. Once Mr. John clicks on the self-analyze button, he'll be taken to a self-analyze page where which is divided into three steps. And the first step involves in uploading of the report. Once you click on the upload button and your report has been uploaded successfully, our machine learning algorithm with OCR support will scan your report and put all your details of the report in this format, which is shown in front of you. What this helps is the user can also see the details or the fields which are missing of these or the details which are wrong. So then Mr. John can edit all of this and then confirm that whatever details we have gone through and found using the machine learning algorithm with OCR is correct. And once he has verified it, he'll click on the proceed button and we'll be going towards the next step, which is step 2. Step 2 gives us a comparison metric of the report, and this comparison metric compares his report with the rest of the users in this platform, as well as it helps him to compare with his friends as well. So this gives a brief clarity about what are the issues which he has and what are the urgent needs which he has to satisfy currently. And once he clicks on the proceed button, he'll be going towards the next step. The next step would be the gym or diet plan. So as we currently know, that Mr. John has a symptom of clearly known, a well-known disease called diabetes. So we will be providing him two options, which is either he can choose gym or diet. It also contains a mix as well, but as Mr. John is old, he would select the diet option. Once he selects the diet option, we'll be giving him a weekly or a monthly plan based on what he needs of how to maintain his diet and rest other things which would be important regarding diet and his health. After this, our next unique feature, which would help people who are having any issues, is online medical. So suppose Mr. John feels that the reports which he has seen after self-analyzing and everything is still not enough, then he can also go and schedule a visit with an online medic as well to help ask for any other help. So once he clicks on the schedule visit option, schedule chat option, then he can schedule the chat with the online medic and clear any queries or any doubts regarding how to go towards recovering his health. Then our next feature is AI symptom checker. This helps us identify any other symptoms which Mr. John might have, which he might not have noticed or would be present in the report. And as we can see, based on our AI symptom checker, we get to know that he also has an itchy eye and a pink red eye. And once Mr. John clicks on find out, we get to know the number of allergies which have been detected and the percentage of it as well. And it also states that Mr. John currently has a 64% chance of conjunctivitis and there is 80% of allergies detected. Then after this, you can click on the sign out button, which is present in the bottom left. And once you have clicked on the sign out button, it signs you out properly. This is our whole walkthrough of the MedHead website. We will now be moving towards the proposed price point of our website. MEDHEAD web service is free to use for the first 15 days, after which the user has to choose any one of our three selected plans. First plan is the basic plan, which involves you seeing the report and as well as the visualizations present in the report with respect to every single user in our platform. And it also allows you to compare your report with your friends so you get a really clear and very good perspective of where you certainly lie and what are the specific symptoms which are at utmost importance. Then moving towards the next plan, that is the standard plan. The standard plan comes with, as again, report seeing, comparison with friends, etc. And another added feature is the AI symptom checker, which is very important. Where if a person has not visited hospitals for a long time, he might not know what extra symptoms he would have gotten. So our AI symptom checker even gives us the possibility of the symptoms which you would have developed as well based on your previous reports. We go towards our next plan, which is the premium plan, which contains all the previous mentioned plans, as well as the gym and food plan recommendation as well, and the online medic support as well. The basic plan has a starting price of 299 per month. The standard plan has a starting price of 499, and the premium plan has a starting price of 799 per month. And the standard plan is our predicted bestseller. Moving over towards the business plan of our website. Uh, so the key features of our business plan or the website is nothing but the reports which we'll upload it. We'll be uploading reports on a rolling basis and the reports shown will be per month. The accuracy of our OCR, feedback of our models from the users, number of active users, and the user retention rate and revenue per user. The unique value propositions which we have are we provide easy access to self-medic features. Patients can also schedule appointment with doctors, the social graph that allows comparison of results among friends. The early adopters, which we think for our website, would be people who are proactive about managing their health and seeking out new technology to help them do so. People suffering from chronic diseases, people who want to lead a healthy lifestyle, and also few old people who are currently living alone and they don't have the specific needs or the possibilities to travel to hospital and other commutes. Therefore, they can use our website, which saves them time as well as the money. Moving over towards our revenue streams, the revenue generation we will be getting will be from displaying the advertisements, as I've spoken before during the website, showcasing that is displaying blogs from ad targeting, etc. We'll also be having commission-based doctor appointments and a subscription model, which I've said before, for premium features as well. Moving towards the development plan of how we are going towards developing this website would be, so the ideation phase went on till 5th to 6th December, and the business model planning went towards from 6th to 8th December. And during this given time, which is till 23rd December, we have gone towards discussing the features, UI design, customer feedback, finding our data set. We also implemented a part of our front end, our back end, and we have completed the implementation of OCR module as well. We have even developed the chatbot, and we have started with our database and model integration. Now, how we'll proceed once we go to the text round would be, we would add more features. This would take about 2 to 3 days, starting from 1st Jan, and we would add UI designs for those features, which would take another 3 to 4 days. We will add in the customer feedback as well for these new features, and we'll improve our more front end, back end, OCR module, chatbot, and we'll be increasing our accuracies for that, and we'll be integrating all these models into our database as well. This video and the idea was presented by Team Cryptix, which comprises of 5 people studying in Vellore Institute of Technology, Chennai. Thank you.